Could you start by introducing yourself?
So I'm Franco Carli. I'm the professor of anesthesia and been working for many years in research and clinical. My specialty is anesthesia, but I've been working very much on perioperative care, medicine, surgical stress response, and surgical metabolism, and then enhanced recovery after surgery, and then more recently in rehabilitation, preparation, patient for surgery. So to some extent, surgical outcome is something that is important since we really intervene before surgery or during surgery in order to optimize the outcome of surgical patient.
Why is improving surgical outcomes a critical priority in modern healthcare?
Well, I think surgical outcome, the whole concept of surgical outcome came very much from understanding that all the intervention we do are really improving the patient's status. So not only from the point of view of the organization, obviously the institution, but from the point of view of the patient. In terms of what is the patient outcome? Well, what does it matter to the patient? What does it matter to the hospital? What does it matter to the surgeon, the clinicians? So this is why surgical outcome came more interested because we want to see efficacy, cost effectiveness to some extent. Cost is very expensive, so that's why we need to be sensitive to the issues that can we improve, what can we do in order to improve the patient's well-being, because that's ultimately, we are considering patient-centric. So what is important for the patient? It's important to have less complication. It's important to be able to walk after. And it's important to reach his family. It's important to be happy. It's important to be available in society, return to society. And that's what this outcome means. So it's important, of course, I think we have to educate students to evaluate, understanding the value of outcome as a mean to understanding the process of surgery. What actually we do to improve the surgical trajectory, to improve eventually the outpatient's outcome. That was important for the students.
What opportunities do students have to learn in evaluating surgical care?
Well, there are, first of all, the students can be, classes, obviously. Also be involved directly into projects. They have to have a project so they can see the real world. And then be stimulated by the supervisor or the speakers of a meeting and so on, to actually understand that surgical outcome is an important aspect of a methodological way to address, and how do they do from the beginning till the end to understand the whole process of care, and that's called perioperative medicine, where the patient is the center, right? So all the intervention comes from the team. When I say the team, could be the scientist, could be the clinician, could be the surgeon, could be the anesthesiologist, the nurses, so all working together for the well-being of the patient. So this is where they have to understand that is a factor-centric. Even if they do biology or they do basic science, ultimately the application is to come up with a center on patient center, based on patient center.
Can you share an example of how surgical outcomes research has improved patient care and the role students played in that success?
Well, I mean, if we look, I give an example of the enhanced recovery after surgery, because it was very much a revisiting, surgery as it was, and based on the clinician center on the clinician, moving towards what is important for the patient. And then we realized that basically there were so many aspects of the care that we needed to understand and modify possibly. So what actually happens with that? We were able to, based on that, we understood that the outcome could have improved from the patient point of view. In the sense that, I'll give you an example, the patient becomes understanding, they understood, or they understanding that they have to participate in this. They cannot be passive. So if you train the patient, or expect the patient to contribute to his healing process, definitely that's improved surgical outcome. So there is a component of technical component, obviously, where you are training your team, your nurses, your physicians, and so on. But at the same time, you train the patient to be involved, to control his own destiny, let's say, control his own care. So that's change, is a paradigm changer. And that's where ERAS came. Now, with prehabilitation that I do very much is to prepare the patient before surgery. So they become much more active, involved, fit, ready for this event that otherwise they would never thought about. Suddenly comes and say, oh my God, what am I going to do? What am I going to do after? So the surgical outcome that we see here at the end is nothing else than what we have prepared them before. Yeah, prepare ourselves and involve this patient and say, are you ready for surgery? What is the problem? What is the anxiety? What is the participation? What is the barrier to achieve that? And education as well, obviously. The patient needs to be educated, like the team needs to be educated.
How does studying surgical outcomes prepare students for impactful careers in clinical research, policymaking, or healthcare innovation?
We need to structure, sure, the proper structure, I don't know, but we need to structure according to the trajectory, surgical trajectory, which that's why we need a surgical outcome, where you take all the different aspects, not only the biology of cancer surgery, whatever, but you take into account basic science. You need the basic science. You need to understand if I are able to intervene and using AI, for instance, or using advanced technology, or using innovative therapy, chemotherapy, or something like that. All these aspects, each of them, put together, not in isolation. In isolation will never work alone, but put together with clinical skills, attention to perioperative care details, preoperative, postoperative care. And then looking ahead, that's where the epidemiologist uses, looking later and say, what actually happens in 5 years' time? Disability. Does the impact of what we do impact on disability in 5 years? Survival here. That's the question, because ultimately we're good in intervening now. We are good, excellent, and so on. But what's happening when the patient goes home? Who is going to follow the patient post-operative? What are we actually looking at? And then, of course, when you say epidemiology means we record the outcome, we record complications, we recording satisfaction from the point of view, participation, and of course we're looking at is ultimately is a better quality of life.
Finally, Do you have any messages to prospective students who would be interested in joining the program you would like to share?
Well, the word outcome is very difficult to discover. I think, if we contemplate on talking about surgery, which is an intervention to make patient better, right? So is a recovery better word than outcome? Recuperation. So outcome could be bad, could be good. Recovery means it's good. You recover. So should we really look at whether the recovery seems to be, hey, I'm going to, run. I'm recovering from this effort. I'm getting better, back to baseline. So, yes, of course, I know if I have complications. Of course, I'm not going to be back to baseline. It will take me time. So, what the student should be involved in this one, I think it probably is, say, the surgery is very common, most common intervention. We can do better than what we're doing now, obviously, improvement. We know that if we don't do well, the risk of postoperative complication, mortality is higher. The data are known. So we want to study more and more that if we intervene on every aspect through the trajectory of the surgical from pre-op to post-op, then we can guarantee better, as we already advanced, but even better. Instead of the 30% of complication, we can go down even lower than that. That's where the students can participate in this effort from understanding not only just the biology of surgery, but understanding how we can modify each element to guarantee a better recovery. And that could be a relative, could be a friend, could be anybody that participate. So they become participatory into this effort to understand more and more the process, surgical process.